What we heard from the Minister, Health Minister Christian Dubé there, was that there have been irresponsible nighttime activities going on, which has led them to make this shutdown decision about bars, changing hours for restaurants as well. And he also spoke about children becoming infected with COVID at school and taking it home to their parents. So that's some of the reasoning behind these restrictions coming into effect, some of them tonight. The schools as of tomorrow, as you heard, the elementary schools will still be accessible for the rapid test rollout that Quebec is now doing, as we've seen in the past day. They've really been ramping that up, trying to get rapid tests out to people. In terms of other restrictions to come, well, that is something that the Minister left on the table, because just on Friday we saw Quebec's government announce that many of these businesses would stay open just at 50% capacity. You can see how quickly things are moving, where they're now at the point that many of those are now being shut down. One thing that has remained in effect today, something that came into effect today, is that indoor gatherings are now restricted to 10 people, outdoors 20 people. Lots of questions to the Minister and other officials about whether that might change ahead of Christmas. And what we heard from Minister Dubé is there will be new modelling sent to the government tonight, and that could change everything. He said don't be surprised if things do change in the coming days.
We will not be scared of going back on certain decisions given the new information. And I'm warning you, I'm warning all the Quebecers. Tonight we're having a meeting with our experts, and we'll have additional information. And based on that additional information, we'll take, again, tough decision. We don't like that, but I think that's the only way to manage this crisis, is to react as quickly as possible.
And all of this coming, Hilary, as Quebec sees more record numbers of COVID cases. Some 4,500 today, up from 3,800 yesterday, which was again record numbers. They are seeing a huge strain on their hospital system. They have about 50% of their COVID designated beds full, about 400 people in hospital right now. You think if the numbers are surging, well, it's only a matter of time, as we've learned throughout the pandemic, until that flows through to hospitals, to intensive care units and to deaths. So all of that they're trying to stem as much as possible by reducing people's contacts. Another aspect of this is an announcement from the federal government that they will be sending in the Canadian Armed Forces Rangers to one area in northwestern Quebec, which is called Bon Espérance. It's a small community, quite remote, population about 700. They are dealing with a COVID outbreak there that has left labs really strained as they try and do testing. That community actually bringing in its own recommendation that anyone from outside isolate for 7 days. So you see that tweet from Minister Bill Blair there, the Canadian Armed Forces Rangers set to go in. No word as yet on what kind of jobs they will be doing, what help they'll be providing, but he said also they stand ready to help any other part of the country as well.
Okay, so Laura, we'll be waiting for more details on that. And of course, whatever this latest modelling is, we'll be keeping an eye on that in the coming days. But there were a lot of questions today to the Minister about COVID testing. That was something we heard quite a bit about. So what is the current situation when it comes to testing in Quebec?
Right, so they're really struggling to keep up with the demand there. 45,000 or so tests a day. That's really overloading not just the testing centres, but also the labs that have to process all those tests. So what we heard from the Minister is if you're not symptomatic, if you have been in contact with someone, if you have no symptoms at all, don't go get a test. Use a rapid test and then go confirm that if it's positive. Leave those spots at testing centres for those actually with symptoms. Now, one other aspect of all of this is booster shots in Quebec. They've actually halved the amount of time you need to wait between your second and your third shots from 6 months to 3 months. Yet right now they're only giving shots out to people 65 plus. Compare that to Ontario, where it is 18 plus right now. Lots of questions today about why Quebec has not been able to move faster. The message we heard back from health officials is that they need more healthcare workers. They have run short on them. People leaving because of the pandemic, people being deployed to hospitals, unable to give out vaccinations, unable to do those COVID tests. So they are trying to ramp up, but they need the personnel to be able to do that, something they hope to do in the weeks and months ahead, Hilary, but it might be a bit of a wait for those people in Quebec and younger age groups really wanting to get their booster shots, Hilary.
Okay, Laura, thanks so much for all of this. CBC's Laura McQuillan for us in Toronto. So for more, I want to bring in Prativa Baral. She's a Montreal-based epidemiologist and consultant to the World Health Organization. She's also a PhD candidate at the Johns Hopkins School of Public Health. So thank you so much for making some time for us this afternoon to help us talk through what we just heard there. Wondering what stood out to you in terms of the message that we got from the health minister and those other officials. What stood out?
The main message that I really got was that we are kind of in a critical situation now. We're seeing cases increasing exponentially to a number we've never seen before in the pandemic. And it's probably an undercount, to be honest, because as was mentioned earlier, our testing capacity is also at limit. So we've been talking a lot about Omicron being more contagious, but now we're seeing visibly on a day-to-day basis what exponential growth looks like. So to me, the main message was really that our health systems are in trouble, and that if you can reduce your risk, if you can reduce potential exposures, please do. Now is the time to do so.
Now, something else that we heard there from reporters asking questions about if they're seeing any evidence that hospital stays are shorter, for example. Of course, Quebec is the hotspot right now, and this surge has come on quite suddenly and quite swiftly. Do you see any potential for this to end or to taper off anytime soon?
You know, Omicron is a new variant, and we're finding out more and more about the variant as we speak. And so it's still very premature to make any predictions of what this can look like in Quebec. We have seen in South Africa, for example, that cases are slowly starting to reduce. But again, they have a much younger population, whereas in Quebec, we do have an older population. So again, very, very early right now to talk about when this could potentially taper. But something to look out for is definitely the rate of hospitalizations, who is being hospitalized, the length of hospitalization for sure. But again, still too early right now to even think about what this could look like towards the end of the peak.
And any sense on when we might actually have more information? Not sure if that's something that you're following, but when we might have a little more information over the coming weeks?
Well, again, it's a day-to-day following at this point. We are seeing what's happening in the UK, where the age demographics is a bit similar in the UK compared to South Africa. So as we follow what's happening in the UK, we'll probably have a better sense of what will happen in Quebec. But we can't wait for that information to act. As we've seen, Omicron is very, very exponential. And so it's best that we act now, reduce our contacts now, and do all we can now to limit the impact on our health systems. Because Quebec is very well vaccinated with 2 doses. There is some protection against severe illness, but as was discussed again today, we do need that 3rd booster shot to boost up our protection again, and we are unfortunately kind of slow in that end as well. So a lot to keep assessing and observing over the next couple of days and weeks.
And of course, you're in Montreal, so you're in Quebec, but for anyone who's been watching this over the past half hour or so and is not in Quebec, what sort of message do you think other Canadians should take from what we just heard there from Quebec officials? You mentioned that Quebec is quite well vaccinated. A vast majority have received both doses, and yet this is what they're seeing. So what message should other Canadians be taking from what we just heard?
If you can get boosted, if you are eligible to get boosted, now is the time to get boosted. We have data from Omicron that suggests that with 3 doses, we're seeing the effectiveness of the vaccine go up towards 70-75%, but with only 2 doses, it's around 35-40%. And so especially for the older population, those with underlying conditions, those who are immunocompromised, if you are eligible to get boosted, please get boosted today. It is really, really, really important because obviously that population is also at higher risk of hospitalization. So as you can see, even 2 doses of vaccines, while still effective in preventing severe illness, is still not enough with Omicron.
Okay, and Prativa, I want to talk a little bit about testing as well. Of course, this is an issue that we're seeing across the country right now. Not enough access to rapid tests, higher demand than there is supply of these rapid tests. If we talk about Quebec, so all Quebecers are eligible to receive 1 package of these 5 rapid tests. Nearly 1,900 pharmacies are stocking those tests. Remind us what these tests can do, these rapid tests, and what they can't do.
So these tests, I have to remind everybody, they're not perfect. They're a lot less sensitive than PCR. However, we are seeing that testing capacity is at limit. And so waiting for days to get your testing result is just not feasible or realistic at this point. And these tests are actually very useful at catching the most contagious cases. Now, because the virus has a long incubation period, depending on when you test, let's say you're testing right after an exposure, the rapid test will not catch that. So generally what we recommend is that people test 3 to 5 days after an exposure, which allows the viral load to be high enough in your in your system for the test to detect it. And you would ideally want to increase the number of tests as well to increase the likelihood of the test catching that infection. I should also point out that if you are using rapid tests to go somewhere before gathering with other people outside of your household, a negative test is not a sufficient reason to just let go of all of your guards. It could just mean that you're still positive, you just don't have enough viral load to be detected. And so I would use it. They're an excellent source, especially to catch the most contagious cases. But again, they're not perfect.
Okay, and that's a good reminder, because I suspect that is the reason why some people have been going out and trying to find those tests. When it comes to the test rollout, wondering what you would like to see done, if there's anything else that you'd like to see officials do in the coming days, coming weeks to try and make these tests more accessible to other people.
Yeah, I mean, these tests were rolled out today in Quebec, so it's still hard for me to predict what are some potential rooms for improvement. I think it's great that we're using pharmacies because they are very accessible to a lot of neighborhoods, a lot of communities. But I do think that we need to be expanding as much as possible these testing kits to as many Quebecers as possible, really thinking through where the neighborhoods are that are being the most impacted and targeting our resources there. As was mentioned earlier today, now we're asking that only people with symptomatic infections go and get tested for their PCR tests. So this means we're going to be relying more and more on these rapid tests. So it's really, really, really important that they are made as accessible and as available to as many Quebecers as possible, especially in the next couple of weeks when we will see and continue to see this exponential rise of cases.
And if we are going to see this exponential rise in cases, what do you think we should all be watching for in terms of hospitalizations?
Yes. So in terms of hospitalizations, really important to see where, who, how many of those of these hospitalizations are occurring among essential workers, among healthcare workers, how long are these hospitalizations lasting for? So all of these things are something that we want to look out for. And unfortunately, the way that we will see these hospitalizations rise, it's always a couple of weeks after we see an increase in cases. So, and we're already at 50% capacity of our health system today. So the exponential rise in cases that we're seeing now and the incoming rise in hospitalizations will occur over the next several weeks. And so we'll have to keep monitoring that and see if there's additional restrictions that unfortunately will need to be placed as a result of this.
Okay, Prativa, we want to thank you for your time this afternoon, for talking us through everything that we just heard there from officials in Quebec. We really appreciate your time.